Welcome, welcome, welcome. I am Belinda Scott Pitts, the proud president of the Suffolk Alumni chapter of Delta Sigma Theta Sorority Incorporated. And I thank you for joining us for our Black Health Series, Community Solutions to the Fentanyl Crisis. We are an award-winning chapter for our impactful programming, and we could not do what we do without the unwavering support of you, our community. Tonight's program is designed with purpose and intention. Our goal is to educate, empower, and equip our community with real solutions to combat the fentanyl crisis, an issue that continues to devastate families across our city, our state, and our nation. Through honest dialogue, shared resources, and expert insight, we are working together to save lives and strengthen our community. To everyone tuning in live, thank you for showing up in real time and lending your presence to this vital conversation. And to those watching the replay, we appreciate you taking the time to engage, reflect, and share this information so that it reaches even more people who may need it. Your commitment, your partnership, and your engagement truly matters. At this time, it is my pleasure to turn things over to our moderator for the evening, Zakia Woods McManus.
Greetings, everyone. Thank you all for joining this powerful and much-needed discussion on the fentanyl crisis. My name is Dr. Zakia Woods McManus, and I am a Physical and Mental Health Committee member for the Suffolk Alumni chapter of Delta Sigma Theta Sorority Incorporated. We'd like to thank the chapter president for that beautiful welcome address. Just for some housekeeping, we will have a live agenda for 2 guest speakers that will bring in great information, plus we'll have some Q&A. And for some tips, please make sure to drop your questions and comment on the chat in Facebook, YouTube, as well as Instagram. We love your feedback, and please make sure to fill out the feedback drop form that you'll receive at the conclusion of this program. We want to extend our gratitude to our presenters for sharing their knowledge and shedding light on an issue that is affecting families, schools, and communities across the nation. Today, we will learn more about the dangers of fentanyl, how it makes our way into communities, and most importantly, what we can do to help protect ourselves and our loved ones. First, we will have Shanice Williams, Physical and Mental Health Committee member for the Suffolk Alumni chapter of Delta Sigma Theta Sorority Incorporated, introduce our first presenter, followed by Kayla Vincent, Physical and Mental Health Committee member for the Suffolk Alumni chapter of Delta Sigma Theta Sorority Incorporated, who will introduce our second speaker.
Good evening. I have the honor of introducing the trailblazing Dr. Nan Nguyen as being your speaker for the Black Health Series on the fentanyl crisis. Lieutenant Colonel Nan Nguyen is a doctor of pharmacy and Air National Guard medical officer dedicated to safeguarding both community health and force readiness. She has led pharmacy reform initiatives projected to save $10 million annually, ensuring life-saving medical readiness across the Guard. During the COVID-19 pandemic, she developed a philanthropic network connecting seamstress groups, textile manufacturers, and shipping partners. Through this global consortium, Lieutenant Colonel Nguyen facilitated the free delivery of more than 2 million life-saving supplies and 200 tons of food to the United States, Afghanistan, India, Mexico, and Vietnam, preventing an estimated 2 million cases of severe illness. Passionate about protecting families from the rise of illicit fentanyl, she framed fentanyl as a public health emergency. Having seen firsthand how one counterfeit pill can devastate lives, she champions prevention campaigns, community education, and Guard-led initiatives to shield future generations. Her message is clear and urgent. One pill can kill. Prevention saves lives. Please welcome Lieutenant Colonel Nan Nguyen.
Good evening, everyone. Thank you for joining us for this Blackout Series event. Tonight, we are here with one mission: to protect our children, our teens, and our community. We are talking about fentanyl, a drug so powerful that one pill, one moment, one mistake can change a family forever. So for the learning object tonight, we will keep this simple and real. We will learn what fentanyl is, why it is so deadly, how it affects children and teens, and what every parent, teacher, and young person need to know. So I'm going to the history. Let me begin with 1 minute of history. So we understand how we got here. In 1990s, opioid pills were pushed as safe. Prescription exploded. Addiction rose quietly. So in the 2000s, when pills became harder to get, many turned to cheaper heroin. Then fentanyl appeared, stronger, smaller, cheaper, easier to smuggle. Next slide, please. It flushed to the United States and changed the drug landscape forever. So here is the truth: fentanyl crisis. Last year, more than 100,000 people died annually from overdose. Nearly 75,000 were from fentanyl. Among teenagers, almost 8 out of 10 overdose deaths involve fentanyl. Fentanyl is now the #1 killer of young Americans. More than car accidents, more than suicide, more than any disease. They are not statistics. They are empty seats at dinner tables. So we can see the video in a minute.
The last minute of 60 Minutes is sponsored by United Healthcare. Reliable coverage for your whole life ahead.
Next Sunday on 60 Minutes, an investigation every American should see. The head of the Drug Enforcement Administration calls the fentanyl crisis the greatest threat we face as a country.
They make it into these fake pills that look identical to pharmaceutical drugs that Americans would recognize, like Oxy or Xanax, Percocet, Adderall. It will be a very massive high that is very short. And that person, they're betting, if they survive, will come back again and again and again to buy more.
So these two drug cartels from our neighbor, from Mexico, are responsible for almost 70,000 American deaths a year?
Yes.
I'm Bill Whitaker. We'll be back next week with another edition of 60 Minutes.
So for the next slide, we can see the chart. We are going to see another movie later. Oh. Okay, here the chart. When you see the charts go up years after years, you see the truth. If we do nothing, the line will continue to raise. You see at the beginning, 17, 47,800 people that because overdose, and it raised to 2021 is almost double. It's like 81,000. And now it's over 100,000 people pass overdose on this. So you see the chart, it costs like $1.5 trillion for all the healthcare worker, criminal, labor, hospitalized. So it's almost 9% of our GDP. So we can go next slide. We understand what is the fentanyl. So understand the danger of fentanyl. So now let's talk about the fentanyl really is. Fentanyl is a synthetic opioid, 50 times stronger than heroin, 100 times stronger than morphine, 2 milligrams. Just a few grains of salt can stop your breathing. So here is what the hardest part. Kids are not choosing fentanyl. Fentanyl is being hidden inside everything. Inside the candy, inside the ring, inside the snack. Next slide, please. So you can see on the counterfeit pill, if you order online, it looks exactly the real pill, but 50% is contain fentanyl. These are counterfeit. And like when the children take the pill, they don't think that's a fentanyl. This one pill can kill. You see the image, it looks exactly what our real drug, real medication, but it's that the color look a little bit different. So missing drug, today street drugs are not a real drugs. They are chemical traps. Fake Percocet, fake Xanax, fake Adderall, and mixed with fentanyl. They may also contain methamphetamine, cocaine, xylazine, the zombie drug, or carfentanil, the powerful one, enough to sedate of an elephant. Next, please. So most illicit fentanyl is manufactured overseas. They ship to Mexico, smuggled into the United States. 1 kilogram, about 2 pounds, can kill 500,000 people. And like you can see on the slide here, the fentanyl is just very tiny compared to heroin. And then only 2 grams can kill the people right away. So next slide, please. So we already talked about the supplier and traffic in the US. The China is the main supplier, and like they transport to Mexico and drug hiding in the cars, in the truck, and on other legal transport goods. The drug trafficker usually traffic by kilogram. And like at the border or on other part, we can tracking only 8%. So the percentage of medication of the fentanyl in the US right now can kill 10 times of the US population. So you see how dangerous it is. So that's on the side, on the border, on the red part, you can see that's the hub. Fentanyl is everywhere right now. Next slide, please. That day we see the map, how the fentanyl sees among 10 most traveler in the US state. You see like 50 kilogram, and you see now the number of pills containing by the law enforcement in the United States since 2017 and 2023. You see the graph increase is from 49,000, 50,000 in 2017. It's go up to 115 million pills in 2023. And this one pill can kill. And this is not addictive because a lot of people, they don't know that's a fentanyl and they already take it and pass away, right? This is a very, very dangerous weapon and the cheapest things. So you can see the fentanyl seizure in kilogram from 19 to 24. You see, like, on these are on the graph to see, like, this one is like, you know, if the fentanyl on the top and the bottom contain xylazine, this xylazine can kill 100 times than other fentanyl. So next slide, please. We will show the video.
We're tracking the path of deadly fentanyl from Asia to hometowns just like yours. Synthetic opioids like fentanyl, again, up to 100 times more powerful than morphine, killing more than 150 people in this country every single day.
Border correspondent Ali Bradley shows us just how it's flowing into the U.S. and sparking major health and safety crises. Good morning, Ali.
Yeah, hi, good morning, guys. So law enforcement along the southern border say that the Mexican cartels control the majority of the border with the United States. And because the border is so vast and fentanyl is so small, it's pretty easy to move. So here's how it all works. It basically starts in China, moves to the west coast of Mexico, sometimes disguised as soap. It journeys across oceans in massive container ships bound for Mexico's western ports, bought in bulk by the Mexican cartels through regular mail services. And from there, Mexican drug cartel workers press the fentanyl powder into small pills. Law enforcement officials say that the labs tend to be in the northern parts of Mexico. The pills are then hidden in secret compartments within trucks and carried between ports in backpacks across the U.S. border. Drugs are headed toward market in Dallas and beyond, or are hidden in stash houses along the border to be moved in smaller quantities. Now, the DEA is moving towards what they're calling a one DEA approach after creating a specialized unit dedicated to pursuing and dismantling the efforts of the Sinaloa and Jalisco New Generation cartel. DHS announcing Operation Blue Lotus, a campaign targeting fentanyl. So far this fiscal year, Customs and Border Protection have already seized nearly 11,000 pounds of fentanyl at or between ports of entry, surpassing all of 2021. And that's easily on track to surpass last year's high of more than 14,000 pounds.
More drugs are getting by. They're able to smuggle more drugs across between the ports of entry and through the ports of entry because they're well aware of the risk. They know that at some point they're going to get intercepted, whether it be at a port of entry or even further down the road. But there's many more vehicles that are getting by, especially just domestic vehicles, commercial vehicles that are smuggling drugs.
Now, Mexico and the U.S. are expected to announce a partnership in stopping the flow of illicit drugs coming into the United States. Mitch, and of course, we'll have those details as soon as they make that announcement.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.
We're tracking the...
So let's talk about the overdose side. If someone overdose, you may see slow breathing or no breathing at all, or blue lips or nails, or pinpoint pupils, or a person who will not wake up. If you see this, you must act immediately. Call 911. Use Narcan if you have it. Next slide, please. So Narcan or Naloxone is one of our strongest tools. It reverses an opioid overdose in a minute. and it is now available over the counter. Narcan is safe. It works on children, teenagers, adults, and seniors. And even if you are wrong, it will not hurt them. So think of Narcan like a fire extinguisher. You hope you never need it, but when you do, it saves a life. So education is our best defense. Kids need truth. Teens need honest conservation. Parents need simple tools. And communities need awareness. If we talk, if we teach, if we check in, we prevent tragedy. Conversation is a prevention. Next slide, please. So they have all the education and awareness, like treatment, rehabilitation, or resort of awareness. Next slide, please. So hidden in snack, the fentanyl hidden in snack. We are now seeing fentanyl hidden in gummy, candy, snack, and vape pens. So with this, our kids, if you didn't open it, don't eat it. If you didn't pour it, don't drink it. So you can see what kids think they are talking and what they got. Kids think Adderall, Xanax, Percocet, party candy, but they actually got the pure fentanyl, methylfentanyl cocktail, silazine or carfentanil or street bill are not real bills. So parents, we need check backpack weekly, inspect the snack and drinks, ask quickly questions, watch mood, sleep change, and keep Narcan at home. 2 minutes per week save lives.
Thank you so much, Dr. Nguyen, for that very informative discussion around fentanyl. Just had a few questions for you today to ask you around your presentation. How can we improve public awareness and education around the dangers of fentanyl, particularly among vulnerable populations, to prevent further overdoses?
So it's a real simple. We teach people the truth in a calm, clear way. We use simple rule everyone can remember, like if you didn't open it, don't take it. We bring the message to schools, church, and community center. No fear, no shame. Just facts, kindness, and protection. When we talk to people with respect, they listen and lives are safe. So that's what I think we need to do.
Thank you. Many slides show that fentanyl is often mixed with drugs like cocaine, meth, heroin, and even pressed into fake prescription pills. How can people, especially teens, protect themselves when these drugs are made to look real?
So that's like usually if you with the medication, they need a precaution. So do not buy any medication online with not a real resource. So
Thank you. I just have one more question for you. I know we talked about overdosing and signs such as slow breathing, pinpoint pupil, skin discoloration. What steps should someone take if they don't have Narcan and they think someone's experiencing an overdose?
Oh, if they don't have a Narcan, they have to call 911 immediately to send, they need, or you need to have a rescue right away. But right now, Narcan, they distribute over the counter and they have a lot of public health resort. They give out the free Narcan to everyone, like in the school or on the street. So we need to develop the method to get the Narcan to everyone.
Thank you so much for your answers.
Thank you.
Good evening, soars and guests. It is my privilege to introduce our second speaker for this critical conversation on community solutions to the fentanyl crisis. Veronica McMillan is a native of Chesapeake, Virginia, and a distinguished nonprofit consultant and trainer whose work embodies our organization's call to service and emphasis on scholarship. As founder and president of the Micro Nonprofit Network, she has dedicated herself to strengthening small organizations and amplifying their impact in underserved communities. With a master's degree in human service counseling from Regent University and over 25 years of experience in education, program development, and community outreach, Ms. McMillan brings both expertise and heart to her work. Her commitment to empowerment has earned her recognition as ACHI's magazine's Philanthropist of the Year and numerous honors, including the Community Impact Award from the National Council of 100 Black Women and the FBI Community Directors Award. Whether serving on the boards of the Worldwide Women's Group and the Black Nonprofit Alliance or teaching at Tidewater Community College, Veronica McMillan transforms lives and strengthens communities through her inspiring leadership. Please join me in welcoming Veronica McMillan.
Thank you so very much, and thank you, Dr. Nguyen, for that great presentation. And ladies, I'm so happy to be able to be with you all tonight. This is my life's passion in terms of working with youth. Our specific area is working with youth on this fentanyl issue because it truly, truly, truly is a crisis in our community. We can move to our slide. I think Dr. Nguyen talked a little bit about those first, that one right there we can skip over because that truly is a fentanyl crisis. And I want you all to take a moment and just look at these pills for a minute, because these are the pills that kids see. And these are the pills that fentanyl is being made out of, because we heard Dr. Nguyen say that fentanyl is a synthetic opioid. And if we can move to our next one, please. I wanted you all to take a look at this picture. I call this the pretty pic, the pretty picture, because when you think about this, the pretty picture, when you think about families and kids, this is a great picture. It starts off, the families are great, the kids are great, everybody's looking good until fentanyl enters into the picture. And then somehow or another, that synthetic opioid ends it all for us. Kids are curious, and this is the big thing with fentanyl. Because of the curiosity of children, this is how fentanyl is ruining this great picture. And then when we think about it from an adult perspective, what we're seeing is, for adults, basically, they're saying, oh, it's not my kid. My kid would not do that. He or she is in church. They go to dance. They do all sorts of things. They're involved in the community in all kinds of ways. But what we know is that kids are being exposed and parents are not understanding the impact of fentanyl. Next slide, please. I think we basically, Dr. Nguyen said this in her presentation, fentanyl is a powerful opioid being added to fake prescription drugs or pills and other drugs that you can buy off the street. But let me just say something, the buy off the street piece of this. We recently, it was last year, we basically do a lot of programs with teens. And we were asked to come to a church over in Newport News to do our presentation. And we have a very interactive presentation that we do when we're working with youth, because youth really want interaction. They don't want a lot of conversation, a lot of PowerPoint presentations. They really want interactive activities. And one of my staff members heard one of the youth in the church say that I get $20 per pill in school. Now, when you think about that, $20 per pill. So here we have this kid who's this church kid saying that he gets $20 per pill in school. Now, let's think about that. Let's say he gives 30, he sells 30 of those. We're talking about a kid that's made $500 in school. So that when we're talking about this buying on the street is not on the street anymore. Fentanyl is so easy to get in schools now that it doesn't make sense. It's very easy. So it's no longer just on the streets. So when we talked about that one pill can kill, we were the recipients of a grant that Governor Youngkin had, I think it was 2023. And basically, we were introduced to helping youth understand what fentanyl is doing in our communities. And when I say it's ravishing our communities, and what's happening is our kids are getting younger and younger, and our children are facing all sorts of kind of things. They're having to deal with the fact that social media, they're having to deal with bullying, they're having to deal with parental issues. We've also found that part of this issue is kids are stressed out. They have so much on their plates. So many things are going on. They're under pressure. And so they're under pressure by parents. They're under pressure from other teens. There's school violence. There's so much going on that's causing them to say, you know what, I just need to get away from this. I just need to get away. We can move to the next slide, please. What I've done in the work that we're doing is basically kind of shifting the narrative a little bit. And I call it awakening the sleeping giant, because we know the issue with fentanyl, but what's happening is the curiosity of kids earlier. We're seeing kids as young as 10 years old talk about fentanyl and talk about stress and all of this. In our last presentation, we saw fentanyl, how it's coming in to our children. One is through the gummies, the edibles, and the vapes. One parent in one of our sessions that we did said to us, she could not understand how her daughter was getting so many vapes because the kids were passing it on to each other. And then we also had to realize, I don't know if you all remember, I can't see you all now, but basically the old school sweet tarts that we had, or Smarties that we had, on the street, the kids called them rainbow fentanyls. So it's all of these funny looking types of candies, but it's a curiosity for kids. And this is how so much fentanyl is being distributed in our school. It's coming in through our edibles. It's coming in through gummies. It's coming in through vapes. And then we know that our children, that the peer pressure and the social media, the media is a leading cause of misuse as well, because we're having so much stuff going on social media that kids they're being overwhelmed by all of this. And we're really going to have to do something. That's why I said the awakening of the sleeping giant, we got to really understand that our kids are suffering. 86% in this third bullet here, between children between the ages of 13 and 17 said they're overwhelmed. We see this all the time when we do our workshops and seminars and our interactive fentanyl activities that we do with kids. They tell us all the time. We hear this over and over. And I would say to you that number is even higher. Kids between this age, they're just overwhelmed. And then we're seeing it younger. We had a mom to tell us about how her child was exposed to it, and ultimately her son committed suicide. We're going to also see the suicide rates go up because of this. Drugs are often provided by someone that they know. We used to talk about stranger danger way back in the day, but right now what we know is that it is coming from someone that the kids do know, someone that the kids are used to. So we really have to pay attention, because our children are being exposed at an earlier age. And then this last bullet here, when fentanyl is present, so is money, guns, and sex. And I don't even think we talk about that enough. Just like this young man said to us, that in school, he gets $20 a pill. So that's money. And then we know when there's lots of money, they're going to protect their money and guns are going to show up. And when guns show up, then we also have money, guns, and then there's sex. All of these things are happening. And trust me, our children know, our kids know. I don't think we understand that our children know more than we think that they know. And we're going to really have to do something about that. Next slide, please. Here's some stats from Virginia stats. And these have changed because these probably were numbers for 2024. The most vulnerable population is that 13 to 19. You know what, you all, I would say even younger now, because we're seeing that. And we're going to have to start having these conversations with our children at home about this fentanyl, but our children are curious. 66% of 12th graders didn't see fentanyl as a problem, because this is the way that they interact with each other. This is how they expose each other to things. This is curiosity that they have. One of our partners, it was a sad story that she shared with us, that her daughter went to school. She shared with one of her friends that, oh my God, I got this headache. And do you have anything for my headache? And the young lady was given what was supposed to be Tylenol. She took it. Of course, it was laced with fentanyl, and she died. And this is what we're hearing in our programs that we do with our youth in the communities. It is a issue, but our kids are not seeing it as an issue. Our 12th graders are not seeing that. And then when they move from 12th grade on to college, is even a greater problem. 10 times more fentanyl was seized at US borders than heroin in August of 2025. That is staggering. And then of course, the Virginia ports is a great access point for fentanyl. We had a conversation with law enforcement probably about last year in one of our sessions, and they were saying to us, or they said to us, that basically it takes 1 minute for a kid to experience fentanyl and then also to get into a container, because what happens is the fentanyl drug lords or what have you knows how much fentanyl to give to a youth, so that it doesn't kill them, but it gets them unconscious enough for them to move to one of these. If you can look at that film, one of those, look at it, the picture that we have here, one of those tankers. A kid, can you imagine basically your kid going to a party, somebody's there that's really paying attention to them, have them overdose, and then in a minute or so be involved in one of these tankers. It's a sad, sad, sad day. And we're going to really, really, really have to wake up. Next slide, please. For me, in working with teens, working with youth, I say that we have to have a different kind of strategy. A different kind of strategy is needed. We talked about basically how fentanyl is coming into the communities, how parents need to be aware. But I think what we have to do is we're going to have to empower youth to lead. Because basically, when you think about this, youth don't get high with adults. They get high with each other. And if we don't empower them to use Narcan, and it's a slippery kind of slope, because parents, I don't want my kid to know how to do that. But when you think about when they go into party, when they're going, going off with their friends or what have you, and all of us have been teens, teen girls, and we know how girls can be and how boys can be. We find ways to do what we want to do. So we're going to have to empower our youth to lead. We have to empower our youth to understand how to get the revive training. And I said it here, provide revive training for youth. And then we also have to make sure that our grandparents are understanding. There are so many grandparents raising their grandchildren now, because maybe the child's parent was incarcerated, or through mental health issues, that parent is not there, but the grandparent is taking care of that student or of that child, we're going to have to make sure that we empower them as well. And then understand how to use Naloxone, making sure that you know how to use Narcan and showing them what it looks like. It's going to be important that we do that. And then we have to have, we heard it in our last presentation with our last presenter, the authentic conversations are needed more than ever. We gotta have authentic conversations with our youth. If we don't, we're going to miss the things that they are dealing with, and they're going to find a way of escape. And with fentanyl being so easily gotten, and then the thing about it with fentanyl, it is, there's no, you can't see it, you can't smell it, you can't taste it. It's mixed with everything. And so it's so much more potent than anything else. And the kids thinking the first time they do it, oh my God, that was the greatest high in the world. We're gonna have to make sure that our kids are knowing what to do and how to use this. Now, with the Virginia Department of Health, they said that they will do revive training for youth 16 and older if their parents are there. And I think we're going to really have to start thinking about that. How do we get youth trained in revive training for youth? So that means parents are going to have to say, okay, I do want my kid to know. I want my kid to be a part of this. And that's in our bullet points here, have open conversations with youth. We got to listen without judgment. You can't go off when they're talking to you about this issue, because there's so much stuff that's going on. We got to monitor the social media. It's so important that we do that. And then design with help and input from experts in the field. We gotta have everybody involved. We got to have the people who are in the community, boots on the ground people. We got to have everybody's a part of this. And then we have to educate. You have to educate yourself and stay informed. Next slide, please. It takes a village. And in this slide, I said, all hands on deck. Everybody has got to be involved. What I would love to see more is more churches involved in this. In our work, we're seeing that some churches are on board and some churches are not. We have to be involved in this. It requires open and honest communication. And no more one and done. Oh, we just do that one presentation and that's it. No, it's gonna require us to do the repeat over and over and over again. And we're gonna have to listen. We're gonna have to listen to what youth are saying. The voices of youth are very important. We have so much adult-driven programs. We don't have enough listening to youth programs. And so that's important to us. Next slide, please, because I'm looking at our time. I just want to make sure. I wanted to just basically tell you all about our work and our impact. In 2024, we conducted 10 Revive trainings, and we want to do more this year. And we had 80 individuals getting the Revive training. We want to do that for youth this year. We served over 200 youth in 2024, and we want to serve more for this year. But this year we're launching our Fentanyl Youth Lab because we know the importance of having the voices of youth on board so that youth can tell us, how do we help you all? And how do we make sure that your voices are being amplified? Because this is an issue that's here and it is not going anywhere. And our children are dying, and we're going to have to figure out what we need to do. And I think that is my last slide for tonight, because I'm over here looking at, there's my information on how you can contact me. And so any questions that you all may have for me.
Thank you so much, Ms. McMillan, for your presentation this evening. We do have a few questions for you.
Okay.
So regarding Narcan, you did mention, having it and making sure that you have it on hand. Are there any particular side effects that anyone should look out for once Narcan is administered?
No, and I think Dr. Noor was saying that earlier. With Narcan, basically, you certainly want to keep it in a cool place, but what we know that there are no side effects from it, even if it's old. Is to have Narcan, let's say for instance, you don't want it in the sun and all of that stuff, and we know that there are not side effects from it. We just want to make sure that it is administered. And I think with the nasal one that most organizations are using, I think that that's the best one, because there is an injectable one as well. But I think for the most part, the nasal spray is the best one, and that there are no major side effects.
Okay, thank you. During your Awakening the Sleeping Giant slide, it did mention alarming data around teens and stress and the rise of fentanyl-laced candies, vapes, and edibles. How can we have more honest and judgment-free conversations with teens about these risks?
Yeah, and this is why I think it's so important to have that conversation with them, because of the fact that it's so easy to be fooled by it. We have to just make sure that they are a part of our conversation. We have to help them to understand, what does it look like? The gummies, the vapes, the edibles, all of that stuff. What does that look like? And tell your kids, listen, don't do candies, don't do anything from anybody else. You got to make sure that you're being protected. And I think that the conversation is the most important thing, honest conversation, and then having them to see. This is what we do in our programs. We call it fake fentanyl when we do our programs, so the kids can see that this is a serious, serious thing.
Okay, thank you. I have another question for you. How can family members and friends best support someone struggling with substance abuse to prevent potential fentanyl overdoses?
I think you just got to be there for them. I think you just really, I think it was in one of our slides, that non-judgment approach, being there for people, using a trauma-informed sort of kind of approach, like what happened. No judging, because it's something when people feel like, oh my God, if I say something to them, I'm going to get screamed at. Somebody's going to think differently of me. I think we just got to have open, honest communication. That's what we need to have.
Thank you. We received another question. What conversations can parents or guardians have with their children before fentanyl exposure?
Yeah, ask children what's going on with them. Ask them, do they know about it? And allow them to lead, because I think oftentimes we're thinking, let me just throw questions at them. Ask them, do they know about it? What do they know about fentanyl? Have you heard? Because trust me, kids know. Kids know where the guns are. Kids know who's doing what in school. Kids know who's got fentanyl. Even if they're not doing it, they've heard a conversation about somebody. So allow them to lead sometime with questions that they might want to ask their parents. Switch it on the kids so the kids can really, really get involved. That's one of the reasons why we're launching the Fentanyl Youth Lab, because I think that we are trying to lead from an adult perspective and not a youth perspective. And kids' voices need to be heard.
I have another question that rolled in. How can we help children not become part of the 66% of teens that believes that they're not at risk?
Yeah. And crazy that there's the children, there's this curiosity thing, always like, it's not going to happen to me. No, it's not. We got to, again, and I said it's like beating a dead horse. What I've found in our programs is that we got to have kids to lead and have that amplified voice, allowing kids to tell us, here are some things that I'm concerned about. Ask your child, what are you concerned about the most in school? And then be okay with the silence first. What's going on in school? I mean, you want to do open-end questions or what have you, but I think that really it's just authentic conversations. Ask them, what would you do if you were leading a fentanyl conversation? Ask them that. And then one of the first things they're going to know is, what is fentanyl? So that brings us into, hey, a great segue. I think you're on mute.
I sure was. I just unmuted myself. Sorry. We do have another question that came in.
Okay.
How do we go about getting Narcan over the counter since a prescription is not needed? The viewer was wondering if there's a screening process or do you just go up and ask for it?
You can get Narcan from your CSBs. You certainly can buy it over, at a drugstore, what have you. But basically, when you do your Revive training, you're going to get your kit and you're going to get your Narcan, the nasal spray, and there's 2 doses in that. And so your CSBs, your health departments, all of those, you can get that from them. And so that way, you'll have your supply. You want to keep it in a cool space and place, but basically you'll have it available. And as I said, I am really this year in the work that we're doing, we're going to get permission from parents to have their children 16 to 18-year-olds understand how to administer Narcan as well. Because as I said, kids don't get high with adults. So if you got 4 or 5 kids together, by the time they call 911 or anything, they're out. I see that Regina just put in 7:59. Okay, we're gonna wrap that up. So that's
Yeah.
Thank you so much, Ms. McMillan. Thank you very much for answering all our questions this evening.
You're welcome. Thank you.
This concludes our session on the fentanyl crisis, One Pill Kills. On behalf of the Suffolk Alumni Chapter of Delta Sigma Theta Sorority Incorporated, we want to thank our presenters, Dr. Nan Wen and Ms. Veronica McMillan, for providing such vital information for their commitment to the community, education, and safety. We also want to thank you, our viewers, for tuning in and taking the time to learn about this urgent public health issue. If you have any additional questions for our presenters, please leave them on our website at suffolkdst.org, and we will make sure that they receive them. Please make sure to complete the evaluation link provided in the chat so that we can continue offering meaningful and impactful programs. Before we fully close, it's now time to share what are the Suffolk Deltas up to. First up, click these links to learn additional information on the 2025-2026 Good Health Wins Resource Guides, Part 1 and Part 2. Next, we have Revive training, taking place Saturday, November 22nd, 2025, from 10 a.m. to 11 a.m. at First Baptist Church, Mahan at 112 Mahan Street. This interactive session will teach you how to recognize and respond to opioid overdoses using Narcan, literally helping you save a life. Space is limited, so don't wait. Scan that QR code and sign up today. Next, we have the food drive from the National Council of Negro Women that will be located at the Salvation Army at 400 Bank Street in Suffolk, Virginia, 23434. This will also be occurring from 10 a.m. to 12 p.m. on Saturday, November 22nd, 2025. Please bring items such as cereal, peanut butter, boxed mac and cheese, and cooking oil to donate to the cause. We welcome all donations. Next, mark your calendars for World AIDS Day on Sunday, December 7th from 11 a.m. to 1 p.m. We'll be worshiping with Little Bethel Baptist Church at 6533 Everett Road in Suffolk. The theme this year is Rethink, Rebuild, Rise towards an AIDS-free generation. We're also collecting toiletry donations, things like soap, shampoo, deodorant, toothpaste, and feminine hygiene products, all unopened, of course. So grab a few extra items during your next shopping trip and help support families in need. And finally, something beautiful is blooming, Growing Violets. This is a 4-month mentoring program designed to support teen moms by helping them connect with professional women, gain mentors, and access resources for themselves and their children. Applications are open now, so share the flyer or the QR code with anyone who could benefit, because every young mom deserves support, encouragement, and community. Be sure to follow us on all social media platforms, Facebook, X, Instagram, and YouTube, to stay updated on upcoming programs, resources, and events. Thank you all for joining us. Stay safe, stay informed, and we'll see you next time.